such a wonderful conference and excellence. I'm very sure that you are not from healthcare industry, and you might be wondering what we are sitting here and what we are doing, right? If you're not from healthcare industry and what is this AR, VR and healthcare topic, let me tell you one thing. No technology is successful unless it is useful. Useful in an extent that we just had a question about negative effect of the technology. However, we also talked about the positive effect of technology. Now, I can't tell you how impressed I am with the use of AR, VR, and some of these, parallel reality in healthcare industry. And reason why I'm interested is it actually brings better result in healthcare outcome and healthcare delivery, be it into the patient's treatment, patient's conditions, reducing the healthcare expenses, increasing the healthcare knowledge or education. So technology, whatever kind of technology it is, it should be useful, viable and meaningful. Agree with me? Right? So we did understand that VR has amazing advantages in gamification, and you see that VR happening and AR happening in gamification, happening into various other industry where products are showcased in retail industry, automobile and other areas. But if you look at the advancement, you would see that the healthcare is a defined area where we only take the evidence-based advancement. We can't take any risk there. And hence the validity of your technology of AR, VR can only be proved with the concept of healthcare, that how viable it is, how meaningful it is. Now 4 of us are here having a various different experience in AR, VR, healthcare and all. But let me give you one figure. You might think that AR, VR is not adopted as of yet. But globally, it is already a $3.8 billion industry. $3.8 billion industry. And it's growing in Western countries by 30%, and soon it would touch $5 billion in no time. Again, you might think that Asia, Pacific countries around here might not be utilizing AR, VR on that level. Here, it is growing on 33% basis. The information is increasing, and the platform like this, and thanks to Eddie, team, Immersion and everyone who's participating, bringing this kind of forum, allowing this kind of discussion will only help healthcare growth. So I will be throwing some questions to my panelists, and they have a really good examples and ideas and experiences. First, I want to start with you, Joy. Where do you run a hospital as an operation officer? Where do you see that really AR, VR or any other parallel technology could be really utilized in a hospital, and also the benefit in terms of the patients? And if you see or if you know about some of the cases within India, it would be beautiful to know.
Thank you, Dr. Prem. And I must tell, the way MC was finding it difficult to talk about otolaryngology. Probably 1.5 years back, AR, VR, what it is and its application in healthcare was also like a Latin hymn for us, many of us. I'm not talking about all of them, but for many of us who are in the hardcore operations. But in last 1.5 years, a lot of exposures, a lot of applications of these technologies have come, or rather we have seen getting implemented, getting looked into in the healthcare delivery system. Now, as you have asked the first question, where all we get to see application of this? Let me tell you, probably a lot of startup companies have come up in last 3, 4, 5 years, and probably in healthcare, most of the startups having some footprint, and they have done something. And most widely used technology what they have currently may not be AR, VR, it will be AI. And a lot of diagnostics tests have been converted through the AI technology. Having said that,
But I'm sure that AI is great, but I think so AR and VR can help present that
so
AI.
I'm coming to that.
Yes.
So some of the pain points what we have, and I talk about some of the challenges for healthcare sector. We have shortage of manpower, trained manpower and skilled manpower. If you think about the doctors, if we need to reach the WHO recommended doctors is to population ratio in India, we need to have 1 million doctors by 2025.
Wow.
We need to have multiplication of that number of nurses in the same period of time, and it is much more if you look at the real workers in the healthcare delivery system, which is the allied health science professional, or we call paramedical professionals. So where we are stagnated, where we are getting challenged, the first thing is training. So training is one of the areas, whether it is doctor's surgical skill, whether it is nursing skill, can be enhanced by using this virtual reality, augmented reality. So in a very broad way, that is one of the areas.
Great.
The second example or second thing I'll tell you, which I'm sure many of you may know, but at least I was not aware till I happened to come across some of the brilliant papers, brilliant research outcomes done by the doctors in US. You'll be happy to know the head of medicine in Mayo Clinic, he has come out and published a paper that his application of virtual reality on his patient, how it has reduced the complexity during their treatment, how it has reduced the average length of stay of the patient in their hospital. So, in other way to say, on clinical outcomes, what we look for, that is one of the key areas where all the hospitals, all the healthcare administrators we look for, there is a significant impact on that. And the third thing, again very broadly, is the patient experience. For a long time, we talk about customer experience, how do you keep your customer engaged. We have discussed in other industry, but in healthcare, the buzzword for last 3-4 years, which has started again from the Western world, and now it is very much in Indian scenario too, the patient engagement and experience. How do you keep them engaged in terms of giving them adequate education about their healthcare or what they should do as a preventive measure, plus how do you keep them happy, how you give them enough tool, enough kind of knowledge, so they are part of the decision making of any treatment. That also can be done by the application of AR VR. Now, you are asking about some of the cases what has been seen in India, or even I'll talk about my own hospital.
Yeah, we'll probably come to that. So, just want to continue on the wonderful discussion which you started on the use case of AI as well. IBM Watson is one of the healthcare AI platform. A normal physician could read probably 2, 3, 4, 5 documents in 15 seconds, a physician about the patient. Now the IBM Watson has an artificial intelligence built in. It can read more than 30,000 diagnostic reports in 15 seconds. So the advantage now in healthcare is that a doctor has way too many information, and an artificial intelligence can present that information, but in a form of AR. So that while patient is being treated, so AR brings that augmented information right in front of patient. You might ask why we require 15,000 patients report, right? If your family member has an asthma or any medical condition, you go to doctor and say that I have breathing problem, I am taking these medicines and this is my side effect. That's all you say. But now the Internet of Things, doctors can know what is the condition, weather condition, your room AC condition from last 1 year, what is the weather condition. So they have a lot more information which could be analyzed by AI. However, AR can present it very well. and it recalls me to the things which you had done, where you had done the surgery with the help of AR's information, Vishal.
Yeah. My introduction to the world of virtual reality came a couple of years back. My chairman was very keen that I take up robotic surgeries, and I was very keen not to take it up. So we were at loggerheads for some time discussing why I should not take up and why. And this, I think, is a very important learning lesson for all developers here, because doctors are a difficult lot. He'll agree with me that doctors are a difficult lot because, if it's industrial 4.0, it's health 2.0 right now. So we are two decades back. And the reason for that is every time that we don't want to change. There's very good publications on this. Why is it that this doctor group is so resistant to behavioral change? Because they are kind of hard-bent on results, and they wouldn't want their results to go down, which is patient care and patient problems, because of a new technology that they want to embrace, which is outside their education domain.
True.
And this is a common problem world over, that doctors don't want to embrace new technology. So when my chairman asked me, why don't you want to take up robotic surgery? I said, no, I'm not interested in it because I'm very happy with my results right now. So I'm just telling you 2 years back how I got converted. So I went, my colleagues at Korea invited me to say, look, we have the state-of-the-art, world's best robotic center. Why don't you come here and spend a few days? If you agree, we'll train you. If you don't, spend a holiday and go back. What they did show me there was not their surgery, but the first day one took me to their innovation center, where actually they were planning for the next 10 years. What they showed me was how will the world look like in the next 10 years. And that changed me. Because what they showed me in that laboratory of theirs, it was an operating setup for animal experiments, for technological advances. And what they showed me there was how the human hands will be assisted, augmented and accelerated for human healing by these machines.
And you utilize many of this technology in your already center. Could you please throw some light on the...
I have one of those devices here, and I was just scrolling through all of those places, moving around, and I said, didn't even see one of those devices. So we got this...
What is this device?
We've made an extended reality device using Epson's help, where we've actually incorporated with our innovators in India and created something for the operating room for surgery. So I wanted to do, when I wanted to do my surgeries, I wanted my juniors to go through it, my students to visualize it. At the same time, distance side. So we did the first robotic virtual reality conference last year, where we had half an empty hall and most of them were on VRs in their respective clinics or in their homes. Why should somebody travel from Bangalore to Mumbai to attend a conference and see it on the screen? I mean, you're going to see that same thing on the screen back. So we actually gave them VR headsets. We actually have 360 devices, because surgical experiences that you see is much closer in a VR 360 immersive device than when you see it outside or when you're standing as an observer. We realized the experiences were much better. So we actually did our first robotic VR interface conference a year back, and I felt it was a huge success because we had people from across the country participate on their VR headsets.
True.
So with these devices, we've been able to get at least about 8 components that this device has right now. Is it has augmented reality capability. So my 3D avatars are created and I can come in as an augmented mentor to another surgeon at a distance and actually guide him on real time.
That's wonderful.
Second thing is, it can live relay my surgeries to any other distance site, to any other VR. Third is, in addition to this, it can also have electronic zoom in, zoom out and direct high resolution capture. So it's a recording device also for me. Now imagine what I technically use. I'm saying as a surgeon who every day operates, I have a design for vision glass, a magnifying glass, for which I've spent 2.5 lakhs. And I use that simple magnifying glass which I've paid so much every day to do my surgeries, which I feel is a gross waste. Now this device, we've made it at about 50,000 bucks. That's it. And this has 8 features, including now we have drone controls in it. We have 360 in it. We have all of these capabilities, all of this together put in it.
I will come back to you on the drone because that's very interesting to know. How do you use drone in oncology, in cancer detection, so that I know some of you might be developer and might be looking into developing applications or advancing in healthcare. So we will come to the truth. Also, we have Dattatreya with us, and he has done great innovation. Dattatreya, briefly, if you could throw light about your innovation and how it has helped in healthcare industry.
I'm involved mainly into using these emerging technologies like AR, VR, and IoT, and then 3D modeling and simulation based technologies for bringing value to the healthcare. And just to before a few years back, while discussing with doctor, he is an interventional radiologist, and now what he told me was like, as a doctor, I probably need to focus on the patient, but in my kind of profession or my kind of surgery, I cannot focus on the patient because my device, when inserted into the human body, is not visible on the human body. So what I have to do is I have to look at the screens which are mounted on the machines away from the patient or on the walls. Now, this is something where the kind of scenario as a patient, as a doctor, I am supposed to focus on a patient, which I am not doing. And I am not really comfortable with this situation, but as a professional, I am doing that. So when I showed this technology, this was the discussion which was happening. I took him to the Infosys campus and showed how HoloLens works. And probably we were trying to figure out what we can do for him. And then I suggested, now what if I replace your screens on this HoloLens and you do the surgery and you look at the patient will be augmented on the HoloLens, and then internally also put it on the human body at the same time. And then he was, with the idea, he was excited, and then we did that. On top of it, we just did not do the small case study, but we also added some functionalities. Like now, what he elaborated further was, at any point of time, I want some information during this procedure. I cannot get that information. I will have to call my technician, and technician brings that information by looking into the computer system and all that. Now, with the speech recognition capability, he can, in the application now, he can give the commands to the application. Probably I want to measure the distance of or diameter of veins or some particular region or some anomalies, measurement you want to do. That can be easily now done. You can issue a command, grab the point at this location, travel to some other location, focus your cursor there, now measure the distance, and that distance is visible. I mean, he need not to wait the technician to go and come back. I mean, you can bring. Now with this, probably, now he is more happy to do this kind of work than a traditional procedure. And at the same time now, just it happened to be a coincidence. 2 days back, he just sent me a WhatsApp. Now currently he is working in London, and he got some video from the Philips company, similar video which is showing what Philips is doing using Microsoft HoloLens, and he was saying that, hey, see this, what we did long back, now someone has forwarded me. So it's not that we did it in a real time, but now this device manufacturer company have understood the value of such technology and trying to bring it to the now as part of their equipment itself.
Superb. And you see, the importance of this technology was augmented. The information was augmented while the patient was on table. So doctor didn't have to look at the wall or a TV screen away. So his whole focus was on the patient. I think so that's where it's a huge game changer, especially augmented reality. I don't see VR as a game changer, but AR has a real great advantages when a patient comes and if a doctor has a medical reports analysis and you can see alongside of the patient's organ alongside of the lungs, you can see all the diagnostic results which you done, spirometer test or any other test you done, and you see the results there. Then doctor can understand the patient as a whole and can analyze as a whole. And similarly, you said that you started something on the drone and oncology investigation. Very excited. Please share some thoughts.
So we've got a patent on a concept of drone bot. It's a drone with a robot. We started working with the government of Karnataka to explore with urban development to solve some slum problems. And this was a big problem that how do we, so I serve also as a member of the Cancer Control Committee in the government of Karnataka, and we were faced with this problem of how do we improve outreach on cancer screening.
Yeah.
And you see eternally government is pressed with the problem of shortage of staff. So ASHA workers at grassroots levels are a major shortage. So we actually piloted and mooted a concept of drone ASHA, where we said, what if the drone can become an ASHA worker, go out to the place, it has high resolution cameras, it does screening, and we had a group of engineers who had developed AI powered imaging based cancer screening solutions, which can actually, like you rightly said, pick up the most suspicious ones. The drones move with the kids, a decent trained health worker. I'm not saying a nurse, not a doctor, a decent health worker at the grassroots level or a social worker there, or the patient alone can conduct self-brushes, biopsies kind of a thing, put it back into the kit, and in half an hour it will be back and 1 hour reported. Was possible. So we piloted some of it here, and just to show the government this is feasible, we have to move to a change. So that was the first pilot we did on looking at, and our AR devices were able to control these drones just on AR prepared thing, which our innovators helped collaborate.
So on point of government, let me tell you, what we are talking here, not only about what hospitals will utilize. There are great initiatives by the government and association. Let me give you a very good example of Australian Breastfeeding Association. All the young mothers, they had trouble time feeding babies, and we all know that mother milk is very important for infant babies. And with the trend goes on where the powder milk is fed to the babies, Australian Association wanted to do something. However, it's a very difficult scenario for a young mother to understand how to breastfeed. You require lots of patience there, you require lots of understanding there. So what they advised all the mothers to wear the Google glasses, and there was direct transmission was going in the association where the interaction was happening, as well as the augmented suggestions were coming up, and suggestion mainly about how to be patient enough, how to understand the entire process, how to make it very relaxing environment for yourself as well as babies. And such a small education play very important role, and the research and results suggested that it made a huge difference in the education. Similarly, as like this 360 VR which we are seeing, camera which is doing a 360 recording by Skybox, they just say that they are working with the government, they got a contract. Skybox people have got the contract for the 360 education. And also you did tell me as well that you're working on some education program in Hinduja as well as external country,
So one of the examples regarding the medical education or the skill development part of it, there is a company UK based called Proximity. So they approached us and they are working with us in terms of how do you give the required training and skill. Maybe your expert surgeon is sitting in the operating room and operating on a patient, and how do you percolate down that knowledge or skill to the people who may not be in your cameras but sitting somewhere else, who may not have the access to get this kind of skill knowledge transfer. So that is something where we are working. But very importantly, the other area where we have taken regarding patient education, and Vishal was mentioning about it too. Well, today what we see, the patients are quite knowledgeable, they are aware, they know what is happening around them. So they expect a lot of two-way communication with them. So in our new facility, what we are coming out with, but that is a company again from Mumbai with whom we are working by the Zenium. So there we have created this kind of virtual reality where a patient can go touch some sorts of a model. There it opens up the information related to the organ, why they should do, what they should do, why they should not do certain things, and sometimes they are using the holograms kind of thing, and by virtue of which they get a lot of information as a two-way communication, which is enabling them to take a decision. Because today the day is like this. Earlier, if a doctor has suggested something, the decision was taken by the doctor. But today, a patient expects that their voice, their suggestions are also taken. And as you gave one of the examples of this thing, your IBM Watson. So that is the reason why IBM Watson has come up today. For the best clinical pathways, for the best clinical decision, they look at each and every patient, every individual in a very unique way. So it is no more like a generalistic treatment is given for the same disease condition for all the patients. It is something like each same diagnosis has to be treated in a different way. So that is another area where we are working.
Absolutely.
If I can add one point to this.
Yeah, sure.
In addition to this, what we were all talking about AR, but in simple VR also, we found some very good utility. One classic example, I remember an ICU patient of mine who was actually stable but had to be shifted out of ICU, deeply depressed. And I chatted with him and he said, you know what, he said, I'm from Mumbai, I'm just not feeling, because I've come from with my relatives here and gone through this surgery, I'm missing chapati. And we actually took him on a VR tour of Chapati. And I'll tell you, that was one of the best things that happened to him in his recovery. A VR tour of Chapati. Similarly, another gentleman from Dubai who loved skydiving. And we were actually able to, thanks to all you developers, able to give them an experience of skydiving with VR. I was amazed to myself to see that this kind of recovery can happen at no cost.
Absolutely.
And I think if I have to pitch to Sir here, as the CEO of a center, if I have to come and tell you as a doctor, look, I need you to accept VR in your centers. What I did was I started using VR for patients in the waiting room, because they were sitting in the waiting room doing nothing, and I told them to take a tour of the hospital in the VR, and they were very happy because that 10 minutes of them was entertainment for them to see what's happening in the hospital, what does Hinduja do, what does this do. Now that gives them an experience. So we also started that for discharge summary, because we realized that at the time of discharge, the patient is in a hurry to go back home and takes the least instruction. So we created a VR video of a discharge for the patient. So we did a discharge summary of how he's supposed to eat, when he's supposed to come back, when he's supposed to do this. A complete 360 VR video which was given to him, saying, "Aap kitni baar dekhna chahte ho, dekh lo usko, and come back to us with questions." Now that made a difference to them.
I completely agree. In fact, the example what you gave about Chowpatty, I happened to experience that in Cleveland Clinic, where a 14 years old boy who was undergoing terminal cancer treatment there, who was very much down and he didn't know what is going to happen with him. And he had a desire at some point of time, which was expressed, that he wants to go for the African safari and he wants to see all this. And that was arranged by them, and he really had through virtual reality, and that video has been captured and that has been stored, that he is moving his turn and he is seeing some from one side tiger, the other side elephants are coming, and he was thrilled. And the most touching experience when that got over, he told, in my last 1.5 years time what I have spent, probably this is the best time. So when somebody is sick and doesn't have much hope on their life, and if you can give this kind of feeling and this kind of experience, it will be some of the best thing what you can give to your patient. So
absolutely. And coming to the example of skydiving, you would wonder to know that one of the beautiful advantages of VR, that it was great in the psychiatry industry of the phobias as well. Some patients who have a height phobia, some patients who have insect phobia, or some of them are germophobia, they don't even shake hand. Whatever kind of phobia you have, with virtual reality, it allows doctor's phobia as well. Yeah, and there's something called white collar blood pressure, right? So every time you go and when doctor checks your blood pressure, it automatically shoots up. Yeah. So these phobias are better treated with a VR experience because a patient is in a real-time experience. So patient, you can't go to 10 feet and walk around or jump, bungee jump or anything. But with the VR devices, you would create an environment, in a virtual environment, which will help you to understand how does it feel. And phobia work, psychology work, diagnostic. I can't tell you how amazing. With the diagnosis, a mix of the elements. You have a watch which monitors your electrocardiogram nowadays, which monitors your lots of breathing habits, standing habits, and all. And then it can produce you into the AR format, so you can do better. So diagnostic is also improving. Surgeries we already talked about. The surgeon has access to information right in front of him. Education, greatest advantage of AR and VR is that you are able to educate patient better, because now you are giving that VR device or the 3D modeling. 3D modeling, I look at his heart. He was actually just saying about the virtual heart. Joy said that you are in a great business, right? So share some.
So I think I talked about that work yesterday. Everybody has in fact seen virtual heart, which we have been doing. Now this virtualization of in healthcare helps a lot. Probably not maybe at the not immediately at the diagnostic and prognostics kind of thing, but probably I can go back at R&D level, maybe let's say as a device manufacturer, or maybe I want to identify what kind of parameters affect certain things, and those kind of level, virtual modeling and simulation techniques will help a lot. For example, this virtual heart, now this living heart project taken by the system has a very big aim. Whenever I am developing, let's say, a stent, it has to go a lengthy FDA process. There are a lot of physical tests has to be done. Nowadays, a test has normally done on animal life, and life is a life, right? We cannot sacrifice the life. So, creating a virtual models and testing those devices several times may eliminate some of the physical tests even required on a human being or on animals or anyway. So in fact, virtual modeling and simulation is getting now, even FDA has also put up approved in a certain areas how you can use these virtual models, simulation based studies to design and develop the devices and adopt them into the product development cycle. So I think that's going to help a lot to bring the product faster and better to the market.
Thank you. I think so. We are sitting between your lunch break and this session, and I definitely don't want to extend it longer. I'm sure that you want to grab your bite. So please ready for the question, and we will have a question just quickly with a very rapid fire kind of question with my panelists first. How soon you think so that India is going to adopt AR and VR as like a Western countries? Quickly.
So the sad part that I see is we virtually got less than 10 patents from India on any of these areas across the world, and that's sad.
Yeah,
which
that's
means
right.
all our innovators are just copying the West.
So you still see that we are very far away?
I filed my first patent, so I know for a fact that we have got nothing.
How many hospitals have you seen successively implementing AR and VR, and what is the rate and what you see that future? How soon?
In India, probably best of my knowledge, it may not be double digit. And first, if you ask me in terms of quickness, I think definitely people are keen and they are ready to adapt. But the problem is there are people like us who are not much tech people till the time somebody approaches us and educates us. And the reason why I'm here because I
and that's why these kind of sessions and seminars are very important.
Where we get educated, and when you get educated, definitely we are very keen. And there are many people like me in the industry who will be very happy to take it forward.
Let me ask you, you said that you did innovation but didn't develop product. How good we are at the innovation in India, and how good we are not implementing any of the innovation we do?
So while doing a lot of R&D and innovation, what I have found probably on the product side and solution side is the ecosystem probably for getting FDA approval, and that kind of ecosystem is not there. And if that is readily available, probably our innovation and R&D will be accelerated. That's
Exactly. So coming to your point when you said that imagination is required for innovation, but here even after your imagination innovation, you need that system which helps you to either patent or implement. So with that we will take questions. Yeah, please.
Sir, I have a question on phobia. In fact, being an academician, I'm more interested in healthcare.
I think so. A student should have a phobia from academician.
Very much. I'm talking about anxiety level in student.
Yes.
How do you make sure VR will help them to reduce the social phobia? In fact, I have done an experimentation on the students by picking around 10 weeks of this experimentation for 10 people by giving a VR headset with the software. I did pre-assessment and post-assessment. So when you talk about pre-assessment, out of 10 points, 8 points was given, that means I have fear. After 10 weeks of assessment of this test on regular interval of time, the same question was been given and answer was reduced to 4 out of 10. But my question is, I have done it for only for 10 weeks for 10 students. Now from a medical point of view, you want me to continue for 1 more year to get of exact findings on that?
Absolutely. I mean, rightly you said that you have very limited amount of use cases and limited activity you have it. In healthcare, you go more precise, more evidence-based, and you do it until you see the patient recovered completely, while you might not see them. But I think so practice remains same, whatever you are doing, and the phobia, dealing with the phobia, VR is amazing. So great work and great suggestion. Any other question in the audience? Yes, we have a question at the end. Any other next question so that I utilize my microphone person effectively? Yeah, okay. So be ready for the next question. Yes.
So one question is, healthcare has a strong ethical dimension.
Lovely.
That's one. Second, and I think that goes back to the earlier session of adoption of VR into industry, whether it's design, whether it's healthcare, whether it's education. A lot of times, people who sign off on the projects or sign off on adopting VR into their industry or enterprise belong to a whole different generation, far removed from reality at times. How do you tackle this in the healthcare space?
So I think to just start off on this, the current generations, if you see, the generation gap will be defined by version gap in the current generation. So the generation gap means my nephew comes and tells me you're of an older generation because you're using iPhone 7, I'm using iPhone 10. So versions are now going to define generations. Time is contracting in this particular point in time. So I think today the way the markets are rolling this thing is, if you are not updated, you are left out. And I think this is very fast changing everywhere. Even in healthcare, where things are being very cautiously approached, is also fast changing. The way robots are coming, the next generation robots are coming in. I chair 2 ethics boards. I chair 2 ethics boards, one in a part of the government and one as a part of another private institute. But both places, my experience is, most places, things are being more acceptable. Things have changed. It's not like before. Yes, you have hurdles because acceptance level is a little lower, but the times have really changed from what last 10 years we saw. So I think we are in a very fast changing time. I don't think you have to worry. Things are going to rapidly change because there is a safety component, there is an ethical component, so we need not panic. The way you will use this technology will define whether it will help us or whether it will kill us. And we need not be too pessimistic about it.
Yeah, and the ethical point of view, healthcare runs on evidence-based treatment, right? And it has to be very ethical. So we do understand that this technology might speed up many things, but not at the cost of treatment or not at the cost of patient, right? Patient is always centric in healthcare. Technology is just a provider, a platform, to reach out to the better solution. Technology is not a replacement at this moment of the doctor's knowledge, doctor's expertise. It still remains at the greatest advantage we have. We use the technology probably either to speed up, reduce the cost, improve the quality of care, reduce the recovery time period, minimal invasive, and all these technology, all these procedures are very important for a better patient experience, and for that we do require AR and VR. In fact, it will be much more ethical, legal, and better if we implement such solutions.
Just one quick closing note. Most basic point on ethics is informed decision making, which means, see, that's why the West does it so well and we wait to copy them. The point is, if you take the lead and if you are able to inform the patient about the entire plan and give the necessary consents and get their approvals, keep moving on. You don't have to slow down.
Okay, we will have one question here.
Yeah, hi. My name is Pritham and I'm an XR developer. So earlier you addressed this problem of adoption, right? Adopting the technology in your environment, industry environment. Yeah, and you also quoted the West versus East paradigm of we adopting it much later. But there is this consistent industry challenge in healthcare with VR generation. So there are no behavior build-ups in healthcare throughout East or West. So and it does not go for treatment but for education as well. So there are parts of XR applications which are built for training, for simulation, right? Not necessarily for treatment, and which can be measured very well with the other simulators that you would work on. I agree that those are larger investments, but roughly for startups who would work out. So I'll put one example that I know of. So until last year I was working with a startup called Immersion. They are into healthcare fertility treatments. They build this simulator. But what would happen is, after all the credibility and after all the momentum that was in towards the product, it becomes those typecasted intellectual products or smart products, like savvy products, which does not see the light of the day at the rate that.
Sure, you got the point.
Yes, we got the point. More of suggestions.
The most important point here for any developer or any person who is developing is that you need to develop the question rightly. See, a lot of people come to me saying, sir, I've developed this particular liver biopsy device, this device, which I've used, and I ask them, how many times have you actually tested before you've done this device? And they said, no, we've only been reading about it, we assumed the problem, we went ahead and developed this based on an assumed problem. You didn't even visit a hospital, you didn't even spend time with the doctor or the patient, you didn't even do any of those, but you sat and imagined. Now that's extreme imagination. And you're putting too much of investment on such an extreme imagination, which will not translate into a market. So the lesson learned here is, do not try those kind of things. Behavioral issues, and that's why we are emphasizing doctor behavior, patient behavior is very, very crucial, and CEO behavior and CEO behavior also. Everything is relevant here, because without that you will not get this. So if you want to plan your device, one is your technology, your innovation, but also the behavior. And how are you going to translate a behavioral change is very relevant. If you cannot induce a behavioral change, do not venture into it.
Wonderful. Thank you.
One following question.
I think so. We need to wrap up the session, but quickly, probably just drop a comment or
So what I was leading to is how can we go to reduction in those cycles where this adoption can act a little faster.
But it's not only in healthcare. These adoption challenges are across, right? Even in other industry also, you see that any new technology comes. Until you create awareness about the benefit, you will not get much adoption of it. So it is anyway going to be.
And I think the one point here is, the quickest way is, that's why most people work on policy. And if the policy level there are adoptions, naturally percolates much faster. So for example, the Drugs and Cosmetic Act, which forms the basis of our healthcare, doesn't talk to the ITI. If there is adoption there that says that, look, we are adopting it, automatically every industry will start pushing it. So at a larger level, quicker, that should be better.
Wonderful. So thank you everyone. We would be still around here, some of us. If you have any questions, feel free to ask us. Very happy to share information. And any developer, as an introduction, they said some of us are investor and innovator. Also, any developer wants to connect with us for any of the opportunities in healthcare, very happy to support you. Thank you, Luke.